Intensified conflict in Eastern Democratic Republic of Congo has cut off regional medical shipments, creating major challenges for diabetics who need insulin. The closure of the Goma airport has left patients and doctors scrambling for alternatives. Now, historically, the Goma airport has served as a key hub for distributing medical shipments from Kinshasa and other international locations. The healthcare providers at the centers in Bukavu work persistently to find new sources for insulin. They ration their stocks and also send doctors across the borders to Rwanda to purchase the supplies. With supply routes blocked, doctors organize trips across the border into Rwanda, hoping to purchase insulin and other medicines that are no longer reliably available locally.
Since the current crisis, access to insulin has been difficult. Even before, insulin access was expensive. For these children, I prescribe treatment, but they are not able to obtain it.
Now, the crisis extends beyond the diabetes center. Pharmacists describe a drug market marked by exorbitant prices and widespread lack of access, with some fearing retaliation from armed groups like the M23.
We don't have access to quality medications. Insulin is unavailable, and its price remains exorbitant, as can be seen across the market. In all depots, there is always a price increase. Even if we go to a neighbouring country to get supplies, they too are often out of stock.
The M23 rebel group's resurgence since January has led to the displacement of thousands. The collapse of the ordinary transport and supply networks has undermined not only diabetes treatment but also care for patients with chronic illnesses. Hospitals and clinics are facing a declining stock of medicines, medical equipment and even food for patients. Our correspondent Louisa Olani has been tracking the story very closely for us and has sent us this report. Listen in.
The ongoing war in Congo has led to alarming consequences, especially as it concerns health, and diabetics are caught in a deadly blind. The critical shortage in medications and consumables continue and have only become worse, with high percentage of medicines and consumables at zero stock. Insulin, for example, is reported to have vanished from shelves as fighting between government troops and M23 rebels cut off supply routes and forces clinics to close. Patients now settle for lesser alternatives that are even not readily available. Aid groups say prices have soared, stocks have been looted, and some patients have even died on their way to care. From Lagos, Nigeria, Louisa Olani, WION, World is One.